Care Network is a community collaboration in our area that involves patients that need that added assistance, that added eyes and ears. It gives our patients the opportunity to get the added attention that they need, but it also provides one-on-one in-home care for our students. Our students don't always face or know of any challenges in real life, and providing this experience gives them the opportunity to see real life challenges and what social determinants that our patients in the community are facing.
They stay on constant communication with my doctor, and they're handling my medicine, which gives me peace of mind. And if anything isn't quite right, they address it immediately.
Well, she comes in, the first thing she does is do my medicine, and she takes my vitals, and she also spends time talking to me. Sometimes I'll ask her about different aspects about medicine, what blood pressure does, how my medicine helps me.
The patients in the program are typically chronically ill medical patients, and by taking care of these patients with health coaches, we're actually able to keep them out of the emergency room. So it really has reduced the cost of care locally. And then I just think it helps the entire community, because these students get a great experience. We have all these doctors volunteering.
Helps them realize what they don't know, in the sense of their own life experience going out into other people's homes, to see some of the barriers to healthcare. I think one of the most important things, particularly with diabetes, is the notion that people have diabetes because they're lazy or because they can't somehow deserve it. And when you realize just how much there is to know about that disorder and how easy it is to make a mistake that you don't know you're making, I assume it can be very humbling, or at least eye-opening for the students. And I think that that's a wonderful thing if you're looking for a career in healthcare, to start out with humility.
We work really hard to make sure that the college students are getting everything to their benefit that they can out of this program. So we teach them lots of techniques, language skills, evaluation skills, presentation skills, even documentation skills. And that focus is for any healthcare provider. So we're not trying to create doctors out of this, though a lot of those students do go on to be pre-med. But we know we have students who are interested in nursing, in optometry, even in vet med kinds of things. And so we're not trying to make little doctors. We're trying to prepare people to be the best healthcare providers they can be, whatever field they choose to go into.
And they get the actual hands-on care on how to take care of patients. They get to learn how to communicate with patients, communicate with staff members, communicate with physicians. That's a big, everyone can be book smart, but learning how to communicate and how to talk to people is something that is learned over time of taking care of patients and practicing medicine.
It's been a joy just to be able to impart knowledge to them and just see their kind of hunger for wanting this. I mean, they seem to all want to be there and want to learn, and just seem really engaged. And I wish I would have had something like that when I was at their stage of learning. So I'm happy to be doing that also.
I think being a part of the health coach program has really added an extra dimension to my education here at Wooster. Beyond just the traditional classroom, beyond lectures, exams, labs, all that stuff gets me out into the community where I can actively do something to benefit other people around me. So that's been really nice. I can also see some of the information that I'm learning in my classes applied in real-world situations. So right now I'm enrolled in biomedical ethics. I took an immunology course last year, and just seeing that what I'm learning in my courses here actually does matter to people and to real-world situations, that's been really nice.
It's always a great time going to teams, because the team meeting that we have every week, because it just allows me to learn. So besides going to the patient's house and doing all the medical stuff, I go there and they teach us about different subjects depending on the day. And it also allowed me to, it's more like of a leadership position on campus, I believe so. which really allows me to have an outreach in the Wooster community, and not just the school, but also the greater Wooster community.
This program is really self-sustaining because everyone really volunteers their time. We have a few staff devoted to it now because it's grown so much, but the doctors all volunteer their time, so it really can sustain. We're 10 years in now. It's the largest program in the country of its type. It's probably the longest running program of its type. We've spoken at national conferences about this program. We've published data about this program, health outcomes. It's been remarkably successful.